Deputy Chief Wilson, you heard from Deputy Commissioner McDonald about the need for safe consumption sites to allow inhalation and to be closer to people. Can you talk about the impact of increased homelessness in major cities contributing to public drug consumption? And would you say that adding more safe consumption sites and allowing inhalation would help counter some of the concerns around decriminalization and that policy in British Columbia?
Absolutely, and it's a great example of the need to have a multifaceted approach to this. It's not just about decrim, it's not just about safe supply, it's not just about education, treatment, prevention. It's about everything together, and increasing the number of safe injection sites, safe consumption sites, where people can inhale as opposed to just injecting, I think is a very, very important piece of that. And when you overlay our increases in homelessness, I think it's really important to provide individuals with safe places where they can use drugs. We know that that's what many people are choosing to do in any event. And, I heard recently from a person who's actually was down in the downtown east side for 20 years and has now been clean for 11 years. It took him literally dozens of times in treatment. And he's only alive today because of the intervention of harm reduction and safe supply services. And so I think that this is a very, very complex issue. It's really important that we take this approach that covers off all different sets of circumstances. Ideally, we provide prevention and education so that people don't start using in the first place. But we also have to address the fact that there are some folks who are entrenched and who are using, and we want to try and keep them alive. And then there's sort of everyone in between. So I think that's probably my largest comment about today, that we really do need a multifaceted approach, and no one approach is better or worse than the other. They're all really necessary.
I want to thank all of our witnesses for being